So I think we'll start. You know, everyone's time is precious. So I just want to welcome everyone to our second workshop with Dr. Stephen Golden, who is the district's pediatrician. I'm not pediatrician, I'm sorry, physician. And we were fortunate enough yesterday that he joined us to answer some questions about what is the disposition of COVID-19, and then what can we do to keep our kids safe in school. So I'm going to introduce Dr. Stephen Golden, and he's right here.
Hello.
And we also have Dr. Patrick Sullivan, Superintendent, right there. And for those of you who don't know me, I'm the Assistant Superintendent, Dr. Scollins. We also have Mary Goodwin, who is our, I guess I would say nurse leader for the town. Is that right, Mary?
Public health nurse.
Public health nurse, okay. And then we also have Pam Fahey from the Department of Public Health also. So thank you so much, all of you, for joining us. This is such an important topic. And I think, we had a nice group of parents yesterday and families to, listen and ask questions. And so the format will be the same. Dr. Golden will speak with us, and then we will have the opportunity for you to ask questions. And families, if you want to use the Q&A box, you can just put your question in there and we will go through those questions as they come. So I guess we'll begin and start with you, Dr. Golden. And if you could, again, talk a little bit about the disposition of the disease on schools, and then also what can we do to keep our students and staff safe? So
yeah. So last night I started and talked a little bit about kind of some of the return to school guidelines, some of the things that the schools are confronting. And I also really started by saying I think it's probably not done in every school district what you guys have provided here for parents and staff. And I think it's really nice. I think it's really a good opportunity for people to get information. And I think that one of the worst things of this whole pandemic has been misinformation, sensationalized information, and a lot of non-evidence-based conjectures. So I hopefully what we'll do tonight is just talk about some of the facts and some of the notions. I will tell you that I do bring some of my own professional experience into it. I've been in the town as a physician for almost 40 years now, and have had 3 children that went to Cohasset school systems. And so I'm a parent, I'm a grandparent, and a physician in the community. And what I did do is I did some research in preparation for this and looked at some of the information from the American Academy of Pediatrics, the American Academy of Family Physicians, the CDC, the Mass Department of Public Health, and also looking at some information that I've gotten from some infectious disease specialists. And I did mention last night, and I will mention tonight and in any other session, that if I can't answer a question, and there certainly were a couple last night that I told I would look up, and we did. I have access to a couple of infectious disease specialists and an immunologist, and if we need to, we can get back to you on some answers, because I think, like I say, I certainly don't want to be someone who's spreading some misinformation. I think that I did get some great information from John Andrews, who's the AMA's Vice President for Graduate Medical Education. And if I look off the screen, I actually have some notes here because I don't have this all down pat. And he is a pediatrician, and he actually made a statement in late June. Basically, the AAP released a statement that with a number of caveats, they were strongly advocating, and this is a quote, that all policy considerations for the coming school year should start with a goal of having students physically present in school. And I'm sure that this was done. And I know a couple of nurses in our office are in other school systems and quite upset about the fact that everything's going to be 100% virtual. Other schools are doing different things, but I think that a tremendous amount of thought by you folks has gone into this, and again, open discussions and sharing of information. I think that I feel very strongly that any decisions should be evidence-based, and they also have to be incredibly flexible, because day in and day out, there's more information coming out about this novel virus. There's, new information that develops, new nuances that occur, and I think that as different schools, and certainly in this situation, Cohasset, implement their guidelines, their guidance, their types of things that they're going to do, whether it's disinfecting protocols, hand washing, sanitizer available, different types of entry into school, that it needs to be nimble and to be able to change. And you may start off in one direction and head in another when new information becomes available or new statistics become available. Andrews, again, I will quote him, felt it was important to recognize that, quote, parents make independent decisions. So I think the most we can hope to do is give you some information, let that marinate with you a bit, and then at the end of the day, no matter what the school policy is, I think parents obviously reserve the right to make their own decisions, okay? He also stressed, and I think all of us recognize this, and especially you educators recognize this, that the benefits of structured education have certain things that virtual education outside of school just can't offer, and that the risk of coming into a situation, small as it might be, has to be weighed against the benefits of not being in that situation. But again, I would urge everybody to think above and beyond not just the medical risks or the physical risks, but also some of the social and emotional risks. And this is something that resonated through the American Academy of Pediatrics and family practice. And it was the different types of things that are offered in the school system other than just math and science and English and all that kind of stuff. And it's some of the benefits of socializing, and certainly some of the programs that are offered, and some of the things that are offered to students that may not have some of the assets that some of the homes have. So again, I think that in short, that was the school policy should be guided by supporting the overall health and well-being of the children, their families, the communities, as well as creating a safe work environment. And I just had those brief remarks to some degree last night, have the same ones tonight, and then would just, again, defer to Mary if she has some comments to make, and Pam and anybody else. And then I guess you guys want to open to a Q&A. So.
Sure. So I'm happy to jump in. So I'm Mary Goodwin. I'm the public health nurse for the town. I've been in this position for 12 years. I've been a registered nurse for 42 years. I have 2 children that have gone through the school system. They're adults now, but one is a teacher as well. So I get the concerns from both sides. My job as a public health nurse is I'm the one that receives any confirmed cases in town, and then I begin the investigation process. I identify the close contacts. Initially, I had been working with the school nurses. When the schools closed in March, they jumped in line behind me. They were really helpful, and they did the contact tracing, followed people through their 14-day quarantine period, and then released them if it was appropriate. I can tell you that we, to date, have had 29 confirmed cases of COVID. So that tells us that our infection rate is really low. As a matter of fact, it's probably one of the lowest in the state. So if any town should feel pretty good about opening their doors, I think it would be us, because our infection rates are really low right now. You know, we'll see how it goes. Again, I work closely with the school nurses. They're a great group of nurses, and you know, they're in the process now of developing some protocols, and so we'll be meeting to firm those up before school starts. So that's basically all I have.
And to jump onto that, Mary, the nurses have been working with Children's Hospital to really kind of hone in on what should those protocols be, and they have been very happy with what Children's Hospital is giving them. So I think that's really helpful too, that they've been working on those. They're continuing those workshops this week with Children's Hospital. So that's going to really help.
Yeah, for sure.
Which is great.
Right.
Great.
And I should add that you know, we work very closely with both Mary and Pam on any health situation that is large and comes up, or anything that could be a health situation, such as a triple E when we did our, mosquito spraying, and when we had a situation with mumps earlier in the year. All of that was channeled to Mary and Pam, and they're amazing with how responsive they are, and how thoughtful they are in their guidance. So we're very lucky to have them as a town. Just wanted to add that.
It's great.
And I'll just say one thing. This is Pam Fahey. I'm the health agent. Like Dr. Golden said, this has been evolving. At this point, there is no one person that's really an expert. Mary and I are on calls 2 times a week with a DPH and then other groups that are contributing guidance and stuff. And boy, when you think about when we started this in March, it's been so long, it feels like. And, in the beginning, they were telling people not to wear masks. I mean, it's hard to even believe at this point that that's what people were saying in the beginning. So, we've been working mostly as a team. We kind of have an emergency management group, which Patrick joins us on the calls. Before, and originally we were doing 7 days a week, and then we were doing 5 days a week, and now we're down to a couple days a week. But it's been a team effort, and in a sense, Mary and I are also teaming with the state. We're the kind of conduits to the state. We listen twice a week to hear what new changes they have, new developments and stuff. So, I mean, all we can do is just kind of try to stay on top of everything, and because no one's been down this road before, nobody knows how this is all going to work. And hopefully, things have improved, the medications and the treatments have improved. So hopefully things will continue to improve. And I feel as good as I could about this whole process. Like Mary said, our infection rate is very, very low starting off as a baseline. So that part's really good.
Dr. Golden, just as we await questions, last night I think you did a really nice job talking about, I had mentioned that I think a lot of people have a sensitivity to what really is the danger here in terms of their exposure to others. I think some folks feel that if that there's what's the difference between the 6 foot distance, the 3 foot distance? How dangerous and susceptible are folks to this particular disease in our schools as they are right now? And what are the major things that schools can do to make sure we avoid people contracting the disease? So I just think there's a general sense of uneasiness, and we're trying to educate folks to get to the point where they're more comfortable about how they're approaching school.
I think at the outset, it was felt that this virus was not a aerosol spread. And I guess I distinguished last night between what people might call highly contagious and contagious. You go back to chickenpox, when there was a lot of chickenpox around pre-vaccination, you'd have one student come into a 2nd or 3rd grade classroom. All they had to do is sit there and breathe in and out, and 95+% of the class got chickenpox. And there is a feeling that this virus does not spread that way, that it spreads more with droplet nuclei, which means that it isn't aerosolized unless somebody intentionally aerosolizes it, i.e. with a nebulizer treatment or respiratory therapy in a hospital setting, which is why healthcare workers in that setting are much more donning protective equipment than are those of us who are seeing patients in our office, or anybody in a situation where they're in an office setting or in school. So if it's not aerosolized, you're not going to go in and just breathe and catch the virus. It would have to be, again, material that lands on surfaces, that is exhaled, secretions. It can be kind of mouth to hand, nose to hand, and then hand on a doorknob. And that's why disinfecting and cleaning surfaces is so important. So that the answer to what the school system can do, which I think what you've done, is sanitization, also mandating mask wearing and hand washing, whether it be soap and water hand washing, which we all know can be excellent, or using any of the gels or sanitizers that come And I think last night a question was asked, is it better to hand wash or is it better to use the hand sanitizers? And I sent that off to the infectious disease specialist, Dr. Ellerin, that I've worked closely with and who's been on some national conferences himself. And he said they're really equivalent. They both do an excellent job, and it's all about the hand washing and cleaning surfaces. To answer your question about what can be done in the school system, I think to allay some fear is that if it were an aerosol spread, you'd expect tens of millions of cases or more than that nationwide, and you just don't see that. So that you have to really work hard at catching it. Well, I don't think you have to work hard at catching it, but if you work hard at not catching it, as evidenced by the prevalence in our community, then you generally don't catch it. And I think taking those precautions is very important.
Thank you. Good. And I should add that we have a lot of PPE, including hand sanitizer. Our town did a great job of ordering that early. And I believe we have up to, Glenn Pratt tells me, over 60,000 possibilities of dispensing 60,000 doses of that, or whatever the word would be. We are going to be asking that all students bring in their own 2 fluid ounce hand sanitizer like this. We have many of them available as students need them. The reason I like this, and we've decided on that, is that it's individualized for students and they can use it without having to pump or do anything that would be sharing of it. And of course, we will supervise students as they use this, but I think it's important that we have our students having these as much as possible. Anyway, I know there's maybe a question here, Dr. Collins, I don't know.
There is. Here's a question about masks that you were going to look into, Dr. Golden. I think you mentioned about working with students who have sensory issues or asthma. What kinds of masks or what can be done?
I think the question was asked, is a shield, I just jotted down, is a shield okay without a mask if someone has asthma or sensory issues, and is it as effective? And the answer, and I'll read it, that came back from Dr. Ellerin was the answer is definitely no. The shield is not as effective. However, not that, there's no real clear-cut evidence about that. And he said, I think the exposed area, especially if airborne particles are concerned. So if you do have somebody coughing, sneezing, and there are going to be some airborne particles involved, the mask obviously be a bit more protective over your mouth and nose than would be the shield. Obviously, if you're working in the intensive care unit, the shield, the mask, hood, and other protective equipment is used. But I think that you have to do the best you can, and I think that if the best you can is to wear the mask, his thought was it's going to help, it just may not help as much.
Right. Yes, and I know we're the school committee tomorrow evening will be voting on the possibility of having masks worn for students PK, K, and 1. The initial recommendations were that students, or guidance, it should say, was students grades 2 through 12 would wear it, but they've left it up to individual communities regarding those PK, K, and 1. My guess is they're going to vote leaning towards requiring it for everyone, but that's only based on my listening to their conversations at the last meeting. So we shall see. If folks have an interest in that and want to voice an opinion on that, that'd be a good time to do so. Would be tomorrow evening at 6 p.m. Via Zoom. The other thing is masks. I was asked previously a few times about the thought of masks inhibiting oxygen intake for students, and I'm wondering if maybe you could add something to that, Dr. Golden. Your thoughts on that as a problem?
Yeah, I think that for most of the general population, certainly students who don't have severe asthma or any other type of lung disease like cystic fibrosis or any interstitial lung diseases, for the average person, it certainly is not oxygen depriving to wear the mask. People who do have significant disease. Certainly, we deal with that some in the adult population where people have chronic interstitial and chronic obstructive lung disease. Their oxygen is compromised to begin with, and sometimes anything, decrease it even a minimal amount can have a significant effect. But it certainly has not been demonstrated that there's a deprivation of oxygen wearing a mask.
That's clarifying. Thank you.
So we have a couple of questions. I will go through them. So our first question is, I'd like to understand how the process will work if a child is confirmed with COVID-19. Will all the children in the class cohort and the teacher then need to get tested and stay home until either confirmed negative or quarantined for 14 days? I understand the protocol document indicates that those within close contact would, and wondering what the current definition of this is, as believe it may be evolving. Thank you.
Mary, did you want to handle that one?
Yeah, I can take that.
Okay.
So the way it would work is someone is confirmed with COVID-19. They're a confirmed case. They are in isolation for 10 days. At the end of 10 days, I would call them and find out if they've been fever-free for 24 hours and if their symptoms have greatly improved. If they say yes to that, they can come out of isolation. What I would then do is work with the school nurses to identify who they have been within 6 feet for 15 minutes. That person is considered a close contact and they are to be quarantined for 14 days. They're also recommended to get testing, but even if the test comes back negative, they're in quarantine for 14 days. And the reason for that is this virus you can incubate for up to 14 days. So you could test negative on day 1, 2, 3, but you could become symptomatic on day 12 or 13. So that's how the process will work.
Mary, could you define for people listening in what a close contact is now considered to be? Because I know that's shifted. In the initial, go ahead.
Well, the DESE guidance, I think, has shifted. I think that's where right. So the confusion is initially DESE was giving it a shorter time frame that they had to be home, they could get tested and then potentially come back. That has changed. It's back to what we've been doing since the very beginning. A close contact is someone within 6 feet for 15 minutes. They are in quarantine for 14 days. That's solid, the 14-day thing. So, but they are recommended to get testing even when they're initially identified as a close contact, because that way we can track the disease, find out if they're actually a case. If they become a case, that's a game changer. They then go into isolation for 10 days. So, but that's what I do. That's my job to figure all that out. But I will be working really closely with the school nurses and the teachers to figure out who are the close contacts. And then of course, if they've been out in the community at, some sort of a event, that has to be looked into too. So contact tracing can be really extensive.
How it impacts us, of course, is the initial guidance from DESE said that a whole elementary class, if there was one student who may have had, would have to be quarantined, and that has shifted because we're going to be able to very much track where students are because of the distancing in a much better way than we would, in the past. Particularly, they'll have assigned seats on buses, they'll have assigned seats in their classrooms. There's a lot less movement in the schools. We're going to know where everybody is, and it should help us with our ability to determine who may have been within 6 feet for a period of, 15 minutes or longer duration. And that doesn't matter if you're wearing a mask or not, correct?
It does not. No.
So there is a question, and they're just asking for clarification about what we're talking about. So I'm going to read this question just to make sure that we explain it. Can you please clarify if it is 10 or 14 days for quarantine? If the virus has a 12 to 14 day incubation period. I only ask because you are saying quarantine for 10 days.
No, so what I'm saying, so if you're a confirmed case, if you have the virus, you're in isolation for 10 days. And the thought is, we know you have it, right? We're not watching you. We know you have the disease, and we know that you're most infectious early in the disease. And by day 10, there's really solid evidence that that's a good point to reevaluate and then take a person out of isolation. The reason you're in quarantine is because you've been exposed. So we don't know if you have it. So we're watching you. We're watching you for 14 days. So I know it gets a little confusing, but it's just you quarantine if you're a close contact and we're watching you. If you become a confirmed case, you're a case. We're no longer watching you. We know you have it. So.
And Mary, to add to that, I'll just read from the DESE guidance when this is the policy. This is hot off the press last week. A policy of when a student or staff person may return to school after COVID-19 symptoms. Initially, it was a symptomatic individual should self-isolate for 14 days and until asymptomatic. And now I believe it's aligning with the DPH guidance,
Right.
which is a symptomatic individual may return to school 10 days from the start of symptoms as long as their symptoms have improved and they have been without fever for at least 24 hours prior to the return to school.
Right.
Accurate?
Yep.
Great.
There is a question around, can you still shed the disease after 10 days?
Yeah, you can shed the disease for quite a while. They're finding, again, you're shedding it, but it's not found to be infectious. So that's why we go with the 10-day period. People shed this, they can shed it for months. And right now, the guidance is that if you've been a confirmed case, we don't recommend repeat testing for 90 days after that, because you can shed it for that long. So.
That's great. I have a
If I can interrupt just for a second, I think Mary made an excellent point just now, which is locating the virus or identifying the virus is different than being contagious. Okay, the virus can be present and not infectious. And I think that's an important distinction.
Yeah.
That is. Thank you. We have another question. Can they wear PPE shield instead of mask? I think you answered it, but maybe they weren't here for that question.
Yeah, I think that's a question that was asked last night that we did get a direct answer on, and it is felt that the shield is probably not as effective as the mask. So the preferred barrier is a mask. And yet, if there are circumstances that present themselves, and this would probably be a decision made by you folks, that the shield is at least better than nothing if the sensory issues and or asthma severity would warrant not wearing a mask. But I think that most of us, both dealing with it in school, with school nurses, and certainly myself in offices, most children with asthma, most, not all, are not asthmatic in a significant manifestation of symptoms on a day in and day out basis. So if they're in school and they're healthy, their asthma should not be adversely affected by wearing a mask. So.
And we have another question that is related to asthma. Is it possible for children with asthma to have their lunch at home? I guess that would mean leaving school to come back. Maybe?
So, I mean, I would recommend from an operational standpoint that that would be something you'd want to tell, depending on the age of the kid, the guidance counselor, the principal, and of course that'd be translated through to the nurse. I'm wondering about the question. This is a tough one. So first of all, sometimes these questions when they come in, we're not sure exactly what you're asking, so we're trying to decipher it. But if it's about lunch and the fact that we're eating lunch in a way that is along the lines of the guidance that has been brought to us, which is to have students separated 6 feet when they do take off a mask to be put in one direction. But if there's a thought of maybe an increased, maybe contracting possibility of the disease because of that, it still would be something you'd want to talk to your guidance counselor, your principal about, and we can try to create accommodations for you if that's the case. And I'm not sure what they would be. It would be dependent on your particular child and their situation. That helps.
Thank you. We have another question. Should kids not wearing a mask be excluded from cohorts?
So kids not wearing them. So we're going to require, right now, it's to require everyone from grade 2 up, and there's a very strong possibility it will be everyone from pre-K up to wear a mask. They'll be required to wear a mask. If there are some medical needs to wear a face shield, we'll cross that bridge and do it appropriately, but it would be really a need, a medical need, or a an individual need in regards to that. We will be working with families to do the right thing, whatever that may be, regarding the wearing of masks, but I want to just reassert that it is a requirement. So it's not okay not to wear a mask, you have to, and we will work with the family to figure out what the root of it is and how we can help that student to make sure that he or she wears a mask. And if that's not appropriate for that person, maybe the remote option would be better for them. So we can talk about that as well.
Okay. If this is a question or hasn't been addressed yet, I apologize in advance. So how will the middle school and high school students deal with class changes? Will they remain in one class and move around, or vice versa?
So not really a doctoral question, but yes, they'll be moving. The students will be moving. Again, we're trying to have them in cohorts. That's important, but they will be changing classes because of the nature of the class. Maybe in a more limited way, but they will be.
Our next question looks like Cohasset doesn't have as many cases. We obviously have children, and it says, what about children that are coming from Boston? Well, that would be the same for staff too. We have staff that comes from all different areas also. So I guess we're just going to monitor it just like we always monitor our kids, and it's up to our parents to make sure that our children are healthy before they come to school. So I'm not sure if there's...
I can just add to that really is the message, that if you're not feeling well, stay home. And that applies to everybody across the board. Stay home. And if you even have sniffles and think, I'm not sure what this is, the recommendation is to stay home.
Yeah, there's a big role for the parent in this, and it's really every morning making sure that if your son or daughter does have any of the symptoms, and maybe the doctors and Dr. Golden, you can talk about what the symptoms are, so folks have a good sense of what they should be looking for. But it's very important that you're vigilant with that, and that you don't take any chances at all that you keep your son or daughter home if you have any of these symptoms. So Dr. Golden, I don't know if you want to add to that or.
Well, sure. And everybody's heard and everybody knows, and certainly we see this, that one of the symptoms is no symptoms at all. That you can have a coronavirus and COVID-19 infection without any symptoms whatsoever. The more common symptoms tend to be respiratory symptoms. They can be sore throat, they can be cough, it can be nasal congestion. And then there's some of the typical cranial nerve issues like loss of taste, loss of smell that can occur. But I think the biggest thing is it's probably not a lot different than it's been for the last, 100 years going to school. If your child is sick, it's better to keep them at home, both for them and other children, and more important now than ever before.
Absolutely. Thank you.
And then the next two questions are more probably operational, Dr. Sullivan. One is, can you talk a little bit about the safety of bus riding? So
Okay, well, just to mention that quickly, we have been given the guidance to keep one student per seat, and there is a diagram we have to follow, which is simply one kid in a seat. We're trying to keep them at least 3 feet apart. They must wear masks, but if one student's sitting on this side of the seat, the next student in the seat in front is sitting on this side of the seat. So it kind of zigzags in and out, one student per seat. We are permitted to have family members sit with each other on buses. Bus seats will be assigned. So, for contact tracing purposes, also for, sanitary purposes, we will be having cleanings between runs, and certainly deep cleanings between the cohort groupings. So every night we'll do deep cleanings of buses. bus drivers will be wearing masks. We're also, there's a social emotional component to this. I'm thinking and by the way, as everyone knows in the community, we are, because of restrictions and the amount of buses we have, providing transportation only for students grades K through 6 outside of a 2-mile radius. So that's a bit restricting, but that's what we can afford folks right now. But we're aware that those young kids, their first experience of school is the bus driver. So we're trying to figure out some ways that, maybe buy some fun masks for some of the bus drivers, figure out ways that we can make it a little less intimidating for the kids as they're having that first experience. But we're really looking at the same safety measures we have in any other aspect of our schools: social distancing, wearing masks, cleaning, touch point cleaning, and deep cleaning at the appropriate times. So kind of how we're going about it.
And is from a medical perspective, Dr. Golden or Mary or Pam, around the safety of riding a bus with all those precautions in place?
To me, it's no different than the classroom. You're keeping your distance. You are, there's surfaces that can be touched, but they should be cleaned. You should be doing all the things you've been doing. Probably not unreasonable to wash your hands after you get off the bus. But wearing the mask, keeping the distance is no different than to me in the classroom.
Great, thank you. And then the next question that we have, and again, this is an operational one: will there be assigned seats at lunch for contact tracing purposes?
Yeah, I that's a good question that we need to talk to the principals about. I don't know if I have a direct answer on that yet. We were figuring out exactly what lunch is going to look like, but we do need to know where everyone is. I think we're more concerned with keeping kids separated from each other, but that's a very good thought, and I don't see why we couldn't accomplish that. So there you go. Remember, just for the operational perspective, we do have a school committee meeting tomorrow, and I'm very willing to answer questions here, but you can certainly come there if you have other medical questions that Dr. Golden and Mary and Pam can help you with. But I'm glad to do what I can right now.
And the operational, probably a very quick answer for this, but only because of time. But this one has to do with asking about the deep cleaning that happens on Wednesdays, what will be done, the products used, those kinds of things. And we are gonna release the products that we use.
Yeah.
They all fall under
EPA. They're all environment EPA, and we're following the CDC guidelines on cleaning, and really working that through with our custodians right now. So if there's a question about a product, I can understand that as I don't think we're introducing new products necessarily, but any product that we use is EPA approved. That's something you should know.
Our next question: any other family members test positive, same household, should we preemptively keep a student out, or can they come if the children is asymptomatic?
Are you looking at that from a school policy point of view or as a medical recommendation point of view to answer that question?
So, I mean, from a school operational point of view, I would say that you would want to keep your student out if they are, but I'll lean on the medical folks in a minute, but if there is any thought that they would have been a close contact, and it's interesting, one of my questions when I was discussing this with Mary is, if the close contact is a family member, how's that going to work? And she rightfully reminded me that you have to self-isolate within your domicile, wherever you're living, is to separate that person from the other people in your family, and that the timeline starts when you're able to do that. Anything from a medical thought that you might want to add to that?
Again, agree with what you just said, and it's kind of like the contact tracing that you do. It's conceivable that people in the same household haven't had 15 minutes, together and within 6 feet apart. So if they have not really been in contact with, then I see no problem. But otherwise, they should follow the same guidance that's being recommended.
Well, my family hasn't seen me much in the last few weeks. I don't think any of them are close contacts to me right now, just so folks know that. But, it's all for a good cause.
Is there a school deadline being set for children receiving seasonal flu vaccine, and will there be a clinic?
Yeah, Mary, you want to start with that?
Sure. So there is a requirement this year that all children 6 months to 21 years be vaccinated for flu. And the deadline for that is December 31st. So I can tell you that our vaccination rates for flu in this state are 80% in children. So we're already have a really good handle on that. It's that other 20% that we'll have to try to go after. But right now, I order all the vaccine for the town, and my vaccine order is based on what I used the year before. So right now I am not planning to do in-school vaccination clinics, but there are options. So people can either go to their primary care, their pediatrician. This year, CVS, Walgreens, and Stop and Shop have all lowered their age limit. So they will vaccinate children 9 years and older. So there are lots of options for people to get a flu shot. I do kids 9 and older. The reason I don't go younger than 9 years, because if it's the first time a child is being vaccinated for flu, they need to get 2 shots the first year. So I have no way to track that. That really needs to be tracked in their physician's office. So, but over 9 years, they only need 1 shot, and I'm happy to do that. So, and I will be having clinics. More to come on that. They're going to be very different this year, drive-throughs and socially distanced, and I'm working on that.
And I would just add that certainly all medical offices are aware of this guidance that's come down, or actually it's not a guidance, it's a mandate to be vaccinated by December 31st. So, flu vaccines are being ordered in probably larger amounts than they have in the past. And for children, it's coming from the state, same as probably Mary's source. So same vaccine, and between medical offices that I know set up certain clinics and just for flu, and the different pharmacies and the town, I think there should be probably adequate supply of vaccine. Then it's just a question of getting people to be on board with being vaccinated.
Thank you.
Our next question has to do with hand sanitizer in younger students. And the concern, is there any concern having younger students having continual access to hand sanitizer, tendency to overuse or misuse perhaps? Well, it's interesting. I just spoke with the nurses yesterday about this, and they discussed the fact that they are going to create videos and all sorts of trainings for all of the things that kids are going to have to deal with, such as how do you wear your mask properly? How do you wash your hands properly? How do you use hand sanitizer? How often? How much do you need? And when do you do it? So all of those things are going to be taught, and we have a nice rollout this year where we're taking our time with our kids. We have the first 6 weeks where we're going to be really implementing all our routines, and those are some of the routines that we're going to have to go over.
Good.
Thank you for that question. That was great.
And if it hasn't been mentioned, our nurses are second to none. They're incredible. I know they were working with Mary and during the really tough point of when the surge happened to contact trace, and they're just amazing individuals. So we're very confident and really glad that they're going to help us with the protocols as well.
And the next question is how long and how often are mask breaks? So
it varies. So the guidance is at least 2 mask breaks. We're going to do more than that. And Dr. Scollins, correct me if you think maybe I'm wrong on this, but the idea is that we're going to have a couple of types of mask breaks. One is the prescribed type, such as what you get at lunch, and we're going to have outdoor time for everyone, no matter what your age, because of the endurance that it takes to build up a little bit to wear a mask. I don't think it's a bad idea at this point to get your son or daughter kind of wearing masks a little bit more in various settings. Obviously they need to do that for safety if they go into building, but we do want to build up a little mask endurance for our students. But there will be breaks when students need it. There'll be a place for breaks. There are all kinds of protocols that need to be followed regarding a mask break. We have tents coming in that will help with some of these mask breaks outside to provide a little shade, and perhaps if there's an inclement weather moment. And, so I think there'll be two types. There'll be the prescribed, and then there'll be the, I need a break. I need to take my mask off, and to be able to do that in a safe area that is separated will be really important.
Great. This is actually a comment, not a question. Well, you all are amazing humans. We really appreciate your hard work to keep us all safe. So kudos. I think that was kind of nice. Thank you so much. And let's see. Sorry, I'm reading. Oh, okay. So this has to do with masks. And this person wasn't at the meeting last night.
Yeah.
And so they're asking, what would the rationale for not requiring pre-K through second grade to not wear a mask? What is the medical and the superintendent position on this? And I think.
Yeah. I like from a superintendent position. I'll be honest. I mean, I've said this before. I have my own kids. I have 4 under 11. One of them is moving into kindergarten, and when the initial guidance came out, and it wasn't recommended for, it wasn't required for students PK, K, and 1 to wear a mask. I had sort of mixed feelings. I didn't know if that was a really if that's the first impression I wanted. For my son going into school, to be around people with masks, wearing a mask. I had some questions myself about whether they'd be able to do it properly. And I've changed my mind on it completely. I firmly believe kids should be wearing masks based on what I've learned from the science, pre-K, K, and 1, as well as all the way up. And I'm not afraid to tell you that, but I'm also not afraid to tell you that I changed my mind. But not that it's my call anyway on masks. It actually is the school committee's call. So they often ask my opinion. That is my opinion right now. But I would, I respectfully understand the role of the school committee in that. And from a medical perspective, I don't know. Maybe I'm wrong. But I'm just telling you how I feel as a parent and as an educator.
Yeah, I don't think there's nothing toxic per se about a mask. Annoying, you could underline that. And, is there going to be a child that is just vexed by having a mask on their face and incapacitated? I'm sure there will be, and maybe the exception may need to be made, or that child would be virtually participating in school. But I think that, again, I don't know what your school committee is going to do, but I think that from the medical profession point of view, there's not a necessary age cutoff.
And just for clarification, the school committee is going to review that policy tomorrow. Those of you who are just joining. So I don't know if that person saw that. And then we have a question. Are schools relying on parents to report students being temperature-free or symptom-free and allowing them to return to school without a physician's note? I guess this must mean related to COVID specifically, or in general? I'm not really quite sure.
Well, I think that actually makes a difference, potentially. But if, my feeling is we always rely on parents to bring us notes from doctors if indeed there is a situation. I would lean on Mary, and I think this is one of those questions that we're still determining, or Pam, about how much communication we'll get from parents regarding if their student, a son or daughter, has COVID or has been a close contact, and what our process would be regarding that. But we'd have to have the information first. So that's kind of the big factor in that question, I would imagine.
Yeah, I think if it's a confirmed case, that certainly is a game changer, right? They're out for 10 days, and then they still have to be cleared by a medical professional before they can come back to school. But if it's a child who's just been out sick, the recommendation from DESE is if a child is homesick, they should call their primary care and potentially be tested. So.
Yeah, but we are reliant. There's a big role and a big responsibility for families in this. And, you know, as Mary said, we're really in a great place, and I am knocking on wood as I say this, but it's fragile. You know, we have to keep vigilant. We have to keep communicating, doing what we're supposed to. If our son or daughters are sick, we need to make sure we do refer to a physician to get a good read on what is going on there, and then you know, be very thoughtful of others. It's a very important time to do that.
We don't have any more questions. I don't know if there's anything that you think we've left out or things that we should
Yeah.
continue to.
Could I ask for a point of clarification from Mary? Mary used the term cleared to return to school by a medical professional. I would consider you a medical professional. If you have followed a case of a positive COVID student and have followed them through, they've been home there 10 days, they're afebrile and asymptomatic, would that be something where you would say you've given them permission to do? Because I think that's extremely reasonable.
Yeah, yes, I have that authority. DPH has given that to all public health nurses. So, you know, we kind of start the investigation and then follow it through. So we have been given that authority to clear people.
No, that's great. And because like I say, it would seem to be an added burden to the family without any significant benefit.
Yeah.
Just have it be rubber stamped by somebody like me and have to come in, have an office visit, be seen, and then be cleared when in fact you really would be the person clearing them. That's great. That's great to know.
Right. And so we also have like template letters that I can give, you know, a parent to give to the school. In this case, I mean, I would just call the school nurse, but we do have that at our fingertips.
Great.
So, yeah.
Are there any other questions that anybody has? Oh, I don't know if someone else has another question. Oh, a couple of things popped up. All right. How many cases will be tolerated before we are forced to go fully remote? Is there a threshold of a case count?
Well, what I would provide for you is what the World Health Organization, the Department of Public Health, and DESE have sanctioned as their percentages, and I believe it's 5%. I sent this out to the community, and it's on our website, but there's a color-coded process for when DESE and DPH recommend that we should be in either remote, hybrid, full in person, and it goes right down. And it has to do with the amount of positive cases within 100,000. So I guess the idea is that if you're under a certain amount, I believe it's 5%, what they do is they factor in, based on the amount of positive tests that they've had, those who aren't getting tested, and they come up with an equation for it. So there are different categories that, you know, obviously if you have a certain amount, it doesn't have to be a lot in a small community like ours. If we had a certain run on these positive cases, we would move. Right now we're in what's called the unshaded category. We would move from that possibly up to a yellow or a red. Hull was in that situation just recently, and I know that they've since been removed from the red, and I don't even know if they're in the green, but they're in a category that is different than us, based on the fact that they had a few, not even a lot, I would say, from a layman's term, point of view, but they had enough that it led the experts to believe that there may be more, and there may be a spread, and that's when we would actually move into that. But there's a lot of factors that DESE wants us to look at, but certainly that's going to be one overarching factor. I should say that one of the pieces of guidance that DESE gave us was about mobile quick rapid testing units. And what they're allowing for is if we do have any of those cells jumping up, or we have even a couple of kids on a bus, I was told, or a couple of kids in a classroom, or maybe a couple of teachers in a school, they could send the mobile testing unit to do some rapid testing if needed, to try to stop that spread. But that's one of the measures that we'll be using. I don't know if there's anything you want to add, and Dr. Golden or Mary or Pam.
Well, like you were saying, Patrick, they have a map that's color coded, and it looks at the town as a whole in terms of your case load, your case rate. And so currently, Cohasset's white, so that's the lowest rate. So technically, according to DESI, they're saying like you should just be all in, but then they leave it to the town to decide which model you want to follow and follow the hybrid. But they were also saying, so let's say that there was an outbreak in your town did start to move up the chain, and you went to like yellow or even red or something. They still allow you on a case-by-case basis to decide if you want to keep going with the school the way you are, because your rate could be going up because maybe there was one event in town. Because like you said, Cohasset's small, so it doesn't take a lot of cases. Say there was an event, but it was people aged 35 and older, and that's where all your cases are. You could still say, we don't have cases in the school. We can still keep going the way we're going. We don't have to go remote yet.
Mm-hmm.
On the other hand, if you had all your new cases were in school, you'd want to take a step back and reevaluate. So even though they've set up these guidelines, they keep emphasizing over and over on these phone calls we have twice a week that it's up to the town to really look at the real circumstances, the deep dive, and decide if you want to just keep going.
And this is why, as a school district, we have to be very nimble with our plans and be able to move to a full remote if we need to. Pam mentioned that, right now we're in the white or unshaded category, and it does allow for full students coming back in a full way. Of course, that is all predicated on the social distancing requirements. Our issue is that with the square footage in our buildings, as I've mentioned several times, we can't get everyone in and keep them apart as we need to safely. And that's really what's stopping us from having everybody in at this point. If the restrictions were lifted, which I don't think they should be, but if they were, then we would be medically in a category where we could have everybody in our buildings. If that makes sense.
So we're just about 7 o'clock. So I think a nice round of questions of all different topics. So I want to thank Dr. Golden and Mary Goodwin and Pam Fahey. Thank you so much for taking your time to be with us tonight, but also everything you have done through all of this. It's been an interesting ride for everyone, and I'm sure for you, it's been quite amazing. So thank you so much. And I'm talking to families. Thank you for joining us. And if you have any questions or any kinds of concerns, please email myself or Dr. Sullivan. We were happy to get back to you about any of the questions that you have around what we're doing here to get back to school in Cohasset. So thank you so much, everyone. And we will have a wonderful night, and we'll hopefully see you again soon.
Looks good, and we look forward to Dr. Golden as he speaks to our staff, and we'll have this recording available for folks on the website. Thank you very much, and have a great night. Good night.
Thank you.